You really need to build something that's gonna take care of their density, match their density, and look like them when all their hair is gone, and still work as their hair is growing back out, because they have like a whole year, right, before they're fully ready often to wear their hair. So they've got like what we call this baby hair that comes back in, and it's almost like a little baby bird. It's like pushing out the cap. So you need room in the cap. A custom wig isn't always gonna work because a custom wig has to be made without their hair underneath, or you take the mold when they have their hair and then you're making tucks. So this is a wig we're still working on. I've started doing the color. We're gonna low light this a little bit more so it looks a little stripy. It's sort of in process. So the client has come and gotten a mold. We've built the wig and now we're kind of working on the color. But as you can see, it has a nice thickness to it, and it's the density of her hair, right? It's not super fine. She had a lot of hair before she got cancer, and she really just wants to look like herself. So this is really important when we're thinking about building a wig for someone. You know, when I build something like this, I ask them for samples of their hair before it falls out. I ask them for photos of their hair when they liked it. And I make sure that the inside has this stretch in it that'll grow back, and that the front is theater lace. I'm not gonna use film lace on someone who's never worn a wig before and is gonna be in and out of this in a year. So this is a great wig. I'm gonna show you the inside first, and then we'll talk about the ventilating pattern on top. So I'm gonna show you the inside of this. I'm gonna flip it this way. So this wig, her head is about 22 centimeters or 22 inches around. And this is really made with a stretch back. So this way, she can't really pull her hair up. I mean, she could fudge it, but this is made with a little stretch in the back so that she has room for her hair to come back in. If I needed to tighten it, I could. It has some elastic on the back, and this allows room for her hair to grow back in. And then the front is a theater lace, and it's doubled over basically to give her a little more reinforcement. So when the hair starts coming in, it's not gonna like basically push through the lace and like cause the hair to come through. So this is a nice thin theater lace. It's not itchy. It doesn't scratch her head. It lays really smooth and it's really strong. So the interior of the cap, this is a really good cap for cancer. As her hair comes back in and it grows back in, and we wanna start maybe incorporating her hairline, we can start to kind of move the wig back and then pull her hairline out along the sides. So for this wig, it's pretty straightforward how it was built. I did single cross knots across the top. That way, you know, you can part it anywhere. It can be parted on any side, wherever. You might need a little water to change the position. I'll show you this. So you can see how easy it is to just kind of change her part a little bit if she wanted to do a side part or a center part. So we did single hairs because she doesn't have a ton of density at top. It's kind of flat, a little lifted in the front. And then when we get to the back of the wig, you can see we did double knots and pretty heavy, 3 to 4 hairs per hole. And that's because we want this thing to last, okay? We want it to last and we want it to hold up through her sweating, through her wearing it. They're not the prettiest knots, but again, we use them in the interior of the wig where you're not gonna see them to really fill it up, have density, and give her some longevity. Hopefully she won't be in it for more than a year. But when we attach this, there's a lot of different ways to attach this. When she loses her hair, we just use a little bit of tape. And when she gets her hair back in, we can either use a headband with combs or some clips, or I could even sew in. This has a little silicone, like stretch silicone on it, as you can see. And this will be sewn on the interior of the wig and kind of stick to her hair or her skin, which also will keep it on and reinforce it if she doesn't want to use clips or something like this. So this is something that we would build for cancer. I just want you to have an idea of what your end result will be. Knotting patterns, cross knotted on the top, double knotted on the bottom, single knots on the side, and we do a nice stretch back to allow room for her hair to grow back.